Good evening, everybody. I bring greetings from India. I'm going to present our midterm metabolic outcome following laparoscopic gastric bypass, which has been done in the Asian population. I bring greetings from my institute, Max Healthcare. The diabetes in India, the prevalence is increasing, and we have a graph showing the increase in the incidence, and it is predicted that by 2020, India will be the diabetic capital of the world. The estimated number of people having diabetes, 2006, about 6.2% population, estimated in 2009, 7.12, and projected to be in 2030, about 8.55% of the population is going to be diabetic. Diabetic prevalence over time in India, if you see, look at the number along with the size, total number of patients with diabetes, patients diagnosed with diabetes, patient receiving care for diabetes, and the patient achieving control with diabetes. So look at the size of the patients and the treatment available, or the glycemic control, total glycemic control achieved in how many patients. We don't even have the exact data. In diabetes, the goal is to achieve HbA1c less than 7%, as well as to delay the end organ complications. Now, the background of this is that the bariatric surgery improves metabolic abnormalities, which includes diabetes, dyslipidemia, and hypertension in obese subjects. The improvement is seen more with gastrointestinal manipulation like gastric bypass and BPD. And the improvement in these metabolic comorbidities is not always proportional to the weight loss. The improvements are seen much earlier before the patient has lost weight. The primary aim of this study was to determine the metabolic outcomes following gastric bypass surgery in the Asian Indians. The including criteria were consecutive morbidly obese patients undergoing laparoscopic ruin by gastric bypass, with patients BMI more than 37.5 or BMI 32.5 with at least 2 major obesity-related comorbidities. The patients were evaluated had at least 2 ITF criteria positive other than the waist circumference to be included as a metabolic syndrome. Now, the ITF criteria for metabolic syndrome: the waist circumference more than 94 in men and 80 in women, triglycerides more than 150, HDL less than 40 in men and less than 50 in women, hypertension 130 by 85 in both sexes, as well as glucose more than 100 mg per deciliter. A standard surgical procedure of ruin by gastric bypass with 6 to 8 port laparoscopic approach, with general gymnoscopy with a tri-stapler technique, gastric pouch of 15 ml, anticolic, antigastric gastrogynoscopy with 25 mm surplus stapler, and biliopancreatic limb length standard 75 cm and elementary limb of 100 cm was done in all the patients. Total number of the patients was 458. Out of this, 151 were male and 307 were female. The age was between 30 and 50. Out of these 458, number of patients with metabolic syndrome were 182, which was about 40% of the total patients, with mean BMI of 47 plus minus 6.2. Now in these patients, the hyperglycemia in these patients, the patients who were on insulin were 39, and post-operatively, gradually the effect was shown, and at the end of 24 months, only 5 patients were on insulin, and at the end of 36 months, 5 patients were still on insulin. The patients on 3 drugs for control of hyperglycemia, 30 patients preoperatively. There was a significant improvement as only 1 patient required a drug after 6 months and no further medication after that. The patients who were on 2 drugs were 54, and only 22 required at 6 months, and at 36 months none required any medication. But the patients which were on 1 drug, 41 patients total in all, 26 required at 6 months and 18 required still 1 drug at the end of 36 months. So if you see the improvement in hyperglycemia in these patients, out of 164, at the end of 36 months, only 23 patients still required either a drug or insulin. Hypertension also showed significant improvement. Patients who were on 3 drugs did not require. Patients on 2 drugs, none required after the surgery. Patient on 1 drug, 125 patients, about 31 patients required that drug even after 3 years. And if you see the graph, the improvement resolution was about almost 80%, from 152 patients to 31 patients requiring at the end of 26 months. It also shows that if the patient require more medication to control the treatment, they are better, the results are better as compared to a little higher blood pressure requiring only 1 drug, in which not all patients respond completely to the surgery. Similar effect on the HDL, which showed significant rise to the normal levels, as well as the results, the triglyceride levels, which decreased with passage of time to the normal range. Now, the weight loss is associated with significant amelioration and prevention of metabolic and cardiovascular risk. And the bariatric surgery has shown consistent long-term result in terms of weight loss and resolution of associated comorbidities as compared to the conventional measures. There is a meta-analysis of more than 22,000 patients where diabetes resolution was 76.8%, lipid profile improved in 70%, hypertension resolved in 61%, and obstructive sleep apnea was resolved in 85%. The life expectancy is reduced by 89%, and the risk of dying by 30 to 48%, which clearly indicates the survival benefit after bariatric surgery. There is decrease in death from diabetes by 92%, the coronary artery disease by 56%, and cancer by 60%. Our observation showed a significant improvement in all components of metabolic syndrome. The overall results were a little higher than the comparative study available in the literature. That may be because of the short duration of the follow-up, which was 3 years under case. Summarizing, there is increase in metabolic syndrome with increased overweight and obesity in India. The incidence of diabetes and metabolic syndrome, as it increases, affects the country's economy as well as the growth. The bariatric surgery, like Roux-en-Y as treatment option for patients with metabolic syndrome. Now we are conducting a trial on patients with metabolic syndrome and low BMI in women by gastric bypass versus the best medical management. I bring greetings from the group which we have.